Hello, I am Ashley Kent, host of GrowthDx. Today, I am joined by Snigdha Udupi, who is the vice president on Capstone's healthcare team, where she works with private equity investors and healthcare companies on how policy impacts growth and ultimately investment decisions. Extremely excited about this discussion today because this is something that I talk about almost daily with all of the organizations that we work with. And I think it's just incredibly interesting how working in healthcare specifically, policy can completely change the game in how you approach your growth strategy or whether it's your investment strategy. I mean, you can have an incredibly attractive business one day, and then there's a reimbursement change, a new CMS rule, shift in Medicaid, and the economics completely shift underneath it. So really excited to hear your perspective, as I know you live and breathe this every single day. And I think this will be an incredibly valuable discussion. So welcome to GrowthDx.
Thanks so much for having me, Ashley. It's an absolute pleasure, and I'm just as excited to have this conversation. I think that it's very topical at the moment in healthcare. But just to intro myself, I'm a vice president at Capstone, and I cover provider services for primarily private equity and corporate clients. So I know provider services is a very broad topic, but I spend most of my time in government payer exposed healthcare businesses and sectors such as behavioral health, women's health, home and community based services, and health systems. And my prior experience was actually working on the provider side in hospital administration and operations. So really excited to share perspectives from that provider angle and now as a healthcare policy analyst working with investors.
It's amazing. You're going to have a breadth of experience and perspectives to be able to share today. And so, kind of diving off of something that I said before, and it's something that I've experienced with companies that we've worked with, something that does make healthcare so unique is that it's completely contingent on what is happening within the market. And there can be, an incredibly attractive company one day, and then something is passed and it completely changes maybe how someone's approaching the business, an investment thesis, whatever that may look like. So I'm curious, when you're looking at a healthcare company, how do you determine how exposed the underlying business model is to policy? And how are you advising partners as you're working through that?
I think maybe to start, one of the first things I would take a look at is payer mix. How much is self-pay, commercial versus government payers like Medicare and Medicaid? That government exposure is really where my team spends most of our time because that's where a lot of the headline risk lives right now. And there's a lot of noise. There's new PE ownership bills that investors really care about. There are a lot of Medicaid headlines that are spooking investors before anyone's actually dug into the policy. So my job is to kind of get underneath the headline and tell someone, does this actually touch your asset? And if so, how? And it's an ever evolving landscape that we're seeing. So tracking some of those changes, whether it's on the federal side or on the state side, I think are all top of mind right now.
That's incredibly interesting because I've worked with companies that, they're able to niche down in the way that they're saying they're working with Medicaid exclusively, Medicaid members, whatever it may be, or maybe if they're working directly with FQs, and then something can completely change within that. I'm curious, as you're advising, your private equity clients, is that something that you're advising them to stay away of, just given the how niche it is and if they don't have that payer mix within there? Or is there still viability into those models where they have a focus and a mission for certain populations? How do you kind of balance the two?
I mean, I think that there's certainly still opportunity, right? I think that something that is so Medicaid exposed might be a red flag for some, but I think there's importance in kind of getting to the underlying dynamics there. So something like reimbursement methodology, it varies more than people might initially think. So something that's fee for service exposed or value-based care exposed or even with bundled payments, I think that'll all have an impact. And I think that other dynamics that are beyond the payer mix that are important to consider are things like the labor model within healthcare. I think that continues to be increasingly complex when you look at the different provider types with MDs, DOs, NPs, PAs, therapists, clinical social workers. So a lot of the policies will depend on which types of providers can deliver certain services, and that varies by state. So I think a lot of different dynamics to unpack, especially as we talk about growth and kind of scaling a business here.
I'm curious if you've looked at businesses where you might look at them and you think, this might look like a growth story, but it's really a reimbursement story. Have you seen any businesses like that where it's completely changed your perspective and how you started thinking about it and what it actually ended up being?
Yeah, absolutely. I think there are actually a few examples when surface level it looks like a growth story, but then I think unpacking it, there are a lot of reimbursement dynamics that are important at play. And, the underlying theme here is that when it's growth that's due to a concentration in a single code or site of care or a benefit category and not necessarily tied to factors like growing demand or a growing population that needs the care. I think one of the most interesting examples that I've taken a look at recently here is in the ABA space, and that's applied behavior analysis. It's a type of therapy for children with autism. And the industry saw massive growth in the last 5 years or so. But I think it's always been a reimbursement story, in my opinion. It's a service that benefited from a favorable billing methodology, like the percentage of billed charges that providers could submit, as opposed to a standardized fee schedule. So it's always really interesting to kind of dive deeper into the reimbursement aspect because it explains why we saw such an explosive growth over the last several years. And I think you can also you could pressure test a provider business by asking if the reimbursement policy changed or reverted tomorrow, would you still see that growth curve? I think that's an important question to ask. And if the answer is no, maybe you're not just underwriting the business, you're more so underwriting the reimbursement policy. But I think it is an important dynamic to uncover.
You can see such pops, but then also declines as that policy changes. We worked with a company that was, working with BBC providers and they were chasing V28 policy changes and what was happening with risk adjustment. And that was something that they were hinging a lot of the product story and growth story around. But, at the end of the day, that's going to continue to evolve. And that's going to take away your growth thesis of, it's not enough to hinge your whole company on. It's something that you can leverage for sure, but can't be what's driving your growth ultimately because it's going to change every single
Absolutely.
day. And how people adhere to that change and implement said change completely varies as well. Well, we talked a little bit about Medicaid. I think it's like the biggest, hairy topic that everyone is talking about. Where is it going? But it's such a great example because policy change, it just doesn't affect just reimbursement. It can affect eligibility, utilization, patient volume, staffing, and which ultimately affects just the total economics of an entire provider organization. So I'm curious, when you're evaluating a Medicaid heavy provider, what are you actually looking at given all of the various dynamics that are a part of it?
Yeah, it's a great question. And I think when you talk about Medicaid, one thing that you hear in the industry is if you know one state Medicaid program, you know one state Medicaid program.
Mhm.
So there's a lot of variability. So as a result of that, I think one of the first things that we look at is the geographic exposure. Is there significant exposure in a single state? How much do we really need to index to certain policies in those geographies? And this is really important because if there's risk of budgetary shortfalls in the state or a decision to cut reimbursement rates, the business could be fully exposed to that cut versus if you're looking at something that has a little bit more geographic variability and diversification. I think what's also important is exposure to managed care versus fee for service Medicaid. I know that the conversation around managed care and shifting more populations to that model has been a popular subject in many states for a number of years now. So, what does that shift look like, and how will that impact certain populations? There are often times that there are opportunities for provider-led negotiations in managed care environments, whereas fee-for-service environments may be a little bit more rigid. So I think that's an important dynamic to kind of evaluate for a company. I'll also typically take a look at a reimbursement rate history, how in any key geographies, how that rate history has trended over time. What does that look like over the last 10 years? And where can we expect, as a result of those trends, reimbursement to trend over the next 5 years? And I think while that rate story and reimbursement, a lot of the conversations are surrounding that rate story, it's important, but I also want to emphasize when doing diligence here, factors like coverage policies, network management dynamics. I think those are all also key in understanding the overall Medicaid story.
I think too for the provider organizations, like you said, if you've met one one state is not the same as the other. And so I'm curious as you're advising provider organizations and they're looking to expand into different states that, and they have a heavy Medicaid population. How do you advise those companies? Because it is going to be a very different environment from one state to the next. What does that look like on the provider organization side?
Yeah. We'll typically start, at the federal level and think about what are some of the macro changes that are happening within CMS, within the administration, what changes are going to be having a downstream impact to states, and then kind of going state by state to understand what are the specific policies that are geographic dependent, because that's going to be the key underlying factor with any Medicaid exposed business. But I think a lot of the concern right now within the Medicaid space and what we're talking to a lot of investors about is changes stemming from the One Big Beautiful Bill Act, or OBA, as we like to shorten it and say, changes that are top of mind for both business executives and healthcare investors. So a lot of that conversation is around work requirements for expansion adults in Medicaid, some of the funding dynamics that will maybe trickle down to state specifics. So things like eligibility eligibility checks that are changing, and that eligibility used to be something that only had to be checked once a year. This is now changing to every 6 months. There's a concern that individuals may get administratively disenrolled if they don't meet that 6-month eligibility check. All of these kind of macro Medicaid policies that are bundled up into this huge policy document. I think our role is to really understand, is this something that's going to trickle down to the specific asset that we're analyzing here and this specific state? So it really starts, I think, from the federal level, and then we look at what trickles down and then any state specific impacts that are going to have a key role.
I love that because it allows you to have that macro view then down to the micro for what that would look like. I'm curious if you've almost have a cautionary tale though on the flip side of that. Like this is great if someone is thinking this way and is being super proactive. Have you seen organizations doing this level of understanding and research that have gotten into a market and it was a huge mistake? Curious if you have any examples of the just downstream effects of what can happen if you don't do these steps ahead of time.
Yeah, and I think there's also concerns about reacting to policies really early. I think that, maybe mid last year when OBA was still kind of a big question mark, when we didn't know the impacts, and it scared off a lot of investors from looking at Medicaid entirely. I think the conversations that we're having now, 1 year later, are entirely different. It's more so, where can we still find opportunity amidst all these headlines and areas of risk that are being highlighted? Are there certain populations that are protected? And I think the answer is yes. There's the pediatric population that's often protected, individuals with disabilities. I think that those are key areas that we can still take a look at as an opportunity within healthcare, and an opportunity to help those individuals and not face as much risk from the business side either. So there's a value in understanding, proposed policies and how they might play out, but also doing that risk analysis, looking at the bull bear base case and understanding what the probability weight of those scenarios are, so that you don't jump too early or react too prematurely to a headline or a proposed policy.
I mean, that is such good advice because, yeah, last year there was so much fear around Medicaid. And, everyone's like, do we need to change our whole model? Do we need to think about everything differently? I was just speaking to a behavioral health platform and, they service FQHCs primarily through telehealth. And we all know that the policies around that have been just looming essentially, but not completely enacted upon. And so it's interesting as they're working with future partners, like what is the risk of us partnering with you if this is your primary delivery method, given where this could be potentially restricted down the road. But at this point, everyone's kind of like, it's just looming. Nothing is happening yet. And so it's kind of like, where do you find that balance of like being very proactive, but also recognizing that there's a lot of steps in between to actually get something to be passed all the way through?
Yeah, it's really about separating the noise from what's actually at stake, right? And I think it's, again, I would say just building out a range of outcomes. It's not just reacting to one possibility. It's building out a range of things that could happen and what's the probability of each of those options. So I think for investors, it's an important kind of decision to make where to maybe walking away from a great company, you can price the risk into deal terms. So I think those are some of the more important considerations and just not jumping ahead, I think, of some of the risks that we might see or prematurely kind of deciding.
100%. So I'm curious to that end, are there certain signals that you're looking for that could move something from we need to just be watching this to like we actually need to change our strategy and do something differently? What is that tipping point when we need to
Yeah.
pivot?
A really good question. And I would say a few things that I think I would watch out for. One, if it's a policy that you're tracking, has this bill been introduced before? Because oftentimes it takes a few legislative sessions for a bill to pass. So if it's something that has been introduced on the floor for a third time, I think that's a signal that there's a push to pass the bill. It's not just something that was, introduced once and maybe it just fell off the priority list. I think the second point is to look at any guidance that's been released. That's often the precursor to actual policy change. So we'll track any guidance put out by CMS, any guidance put out by states, and kind of test what the reaction to that was before, we see actual policy changes. And I think another point, especially on the state level, to kind of distinguish between what's maybe noise versus actual risk is looking at neighboring states or generally other states across the country that have been successful in passing similar legislation or similar policies. States often copy bill language. We see this all the time when bills are proposed. So I think that's going to be a key indicator of, is this something that is likely to materialize or is this something that is going to remain in the proposed stages?
Going back over to the policy and, how it actually becomes a growth strategy. There's companies they've built enormous businesses because they understood where reimbursement or policy, was moving before everyone else did. When should an operator actually lean into policy as their growth strategy or maybe even on the investment side, as they're building their thesis versus the other way around?
Yeah, it's a really great question as the policy landscape is always shifting. I think that's what makes it interesting for me to track. But as you kind of think about where you can lean into it as a growth lever, I think leaning into policies that have survived multiple administrations and are considered bipartisan are probably the most durable, right? So shifts to managed care, like we've discussed, or value-based care, I think are really good examples. These are ideas that have been building for years and years. They're likely to continue accelerating despite, any sort of political changes or political party changes and offer that durability where you can really lean into it and kind of build a growth strategy around that.
From the investor's lens, I'm curious too, so you have companies that are building this on a durable change. We've seen this over the years versus maybe a temporary regulatory tailwind that's happening right now. How are they evaluating the opportunities that are in the market? And are there some that are a bit more opportunistic? I've worked with a company and they were there. It was exactly this as the beautiful bill was getting passed and every 6 months re-enrollment was happening and people were falling off. There's a company that literally makes sure that people don't fall off and like their value all of a sudden
Yeah.
skyrocketed. They were acquired, and it happened really quickly because of policy. They've been around for years and years, and it completely changed. So, from the investor lens, how much are they having this as a core thesis versus something that like we got to jump on this right now?
Yeah. And I think that example that you just showed is a great one in finding opportunity amidst a lot of uncertainty. I think when OBA was introduced, everyone had questions and it was unclear, what was going to stick and what wasn't. And I think this is a company that understood the policy change and knew that some of the disenrollment risks were real risks and things that were going to stick around. So they created a huge value add in that market. So I think the other thing is to really understand the underlying policy dynamic and in other words, like how difficult would it be to reverse this policy? I think is probably the main question I would ask. If it's an idea that's baked into something like a waiver program, something that needs renewal over time, it may not survive that next renewal period. And that may be a real risk. Something that's already codified in statute will require additional legislation to change it. And that's a much higher threshold for a policy change than something that hinges on a waiver renewal or administrative action. And I think the challenge with OBA and some of the disenrollment impact, the challenge there and why I think this company maybe thought that it was a good time to jump in, it almost saves a lot of money, and there are significant cost savings that are outlined in the bill. That's hard to kind of move away from once you've already introduced some of those statutes. So it's challenging to outline provisions to kind of benchmark or estimate the cost savings. And then if you walk back the policy, you probably need to find the cost savings somewhere else. So it's a lot easier, or it's a lot harder rather, to change that and to revisit it. So I think when we think about durability, look at the underlying mechanism that even introduced the policy in the first place and how easy it would be to reverse or change that.
Yeah, no, I think that's such a great point. Well, I want to take you back to something you said at the very beginning. There are certain sectors that don't carry the same amount of risk. You mentioned pediatrics being one of those. I'm curious from the pediatric perspective, what makes it particularly interesting or risk resistant from a policy and reimbursement perspective?
Yeah. And it's an area I spend a lot of time in and an area I think I really like analyzing. But to your point, the provider services landscape is very fragmented. There are often key questions that repeat across these sectors that we cover, things like coverage, utilization, reimbursement history and outlook, demand drivers. But the importance of these categories when doing diligence vary. And I think in pediatrics, it's a really great example of durable policies that we've been discussing. There's a federal mandate in place for states to cover services for Medicaid eligible individuals under 21. It's called EPSDT. That would take congressional intervention to change, which would be very difficult to do. So the rollback of that would be very challenging. And I think what's underrated about this protection that we see for children or individuals under 21 is that it's not just a federal requirement for states to cover these services, but they have to ensure that there's adequate access to care. And a way of doing that is to ensure that reimbursement rates are high enough for providers and sufficient for providers to actually deliver those services. And that's a pretty unique level of protection for this population. And I think what's also interesting is that the pediatric space, we see a high likelihood for legal action if the access to care is hindered. I think something about, ensuring that children have access to the care that they need is something that's been experiencing bipartisan support. It's not really a political issue, and that there are very real policy impacts that you would see if a business or a policy change at the state level or federal level could change. I think that this population is particularly insulated amid any sort of political turmoil or policy changes that could come down the line.
And it's confusing as well because you're going to have within states, you're getting auto assigned. You've lost your provider who is no longer in network. You're now getting assigned to a new provider. And it's interesting because what happens in these auto assignments, a new provider group, I actually work with a pediatric group who just literally yesterday ran a new campaign where they had over 1,800 auto assignments that they've been sitting on because they just haven't had the bandwidth to be able to do any sort of proactive outreach. And we were running a baseline number to see, how many just from the letter that they received did they actually proactively go and schedule care with that. And there were, 50 or so that did that within there. And I'm curious from your perspective too, what level of responsibility does the provider group have to ensure that the patients are getting in to receive that care? Because that disconnect between the payer conversations and then also the provider who's going to be receiving them, when maybe you don't have the infrastructure to do that. We just launched a campaign yesterday. We had immediately 80 people reach out to book. And it just shows you how there's a big disconnect between the communications of the payer and the provider and what responsibility kind of falls within each group to uphold those contracts.
Yeah, and I think that's a responsibility that might come into play even more now as we've talked about these Medicaid changes and eligibility changes because you're shifting from 12-month checks to 6-month checks. So you want to be in communication with those patients and you want to ensure that they're not accidentally disenrolled. So I think that layer of communication is going to be more important than ever. And of course, it'll depend on the payer mix of the business. But I think especially on the Medicaid side, it's more important than ever to kind of have that ability to communicate effectively and have a consistent stream of communication to ensure that there's no accidental disenrollment. And again, I think an opportunity for, any sort of AI enabled or tech vendor to maybe assist with this because to your point, a lot of providers may not have the capacity to be doing that for every individual. So I think this is also an area where a policy change will both on the federal side and on the payer side can result in an opportunity for a business to build a platform that would help bridge that gap.
Yeah. No, it's been incredibly interesting. Without us there, they would have just hoped that they would have shown up. And we see that it's such a small percentage that actually make that leap. Even if they are giving away $50 gift cards or whatever it is, incentive that the payer is sending out there. And, it was as simple as they started leveraging text message for them to be able to book immediately, and very different than receiving a letter in the mail. And exactly to that point, if you don't move very quickly, 6 months could pass and that coverage could lapse and you've missed out on that opportunity to support that population.
I think that was the right reaction there. It's like, you kind of have to meet people where they are. I think the text message is a great idea. I think historically we've seen the letters go out and they get missed in the mail. People don't check their mail that frequently. So I think it's a great way to kind of step in and bridge that barrier and ensure that communication is not lost. So I think that was the right reaction.
Don't we laugh? We're like healthcare, text, novel, idea. We're like not prefer to be able to reach people, but that's just the reality that we work in and
Yeah.
just the everyday. I'm curious if you're thinking of, other practices and specialties. You say everyone is so different. If you were to pick, another one that has been gaining a lot of investor attention, whether it's women's health or personal care, dental, which one are you seeing as being one of the most attractive areas, and particularly around policy and how that's been shaping that thesis?
Yeah. Maybe we can start with women's health. I think we spend a lot of time in the fertility space within women's health and the fertility market right now is I think entering an interesting period of sustained growth and structural expansion for really few reasons. I think there's growing bipartisan support for IVF. There are broader coverage mandates that we're seeing across states and generally just increasing utilization and demand that's going to help drive that long-term growth. There are certainly some barriers and it's more so on the pricing and reimbursement side where it's primarily a cash pay business in a lot of situations and pricing continues to be fairly opaque as a result. But I think as the market matures, we might see a little bit more of standardization and transparency there. But it's been a really interesting one for us to look into because some of the more standard dynamics that we've talked about, like reimbursement and outlook there and Medicaid changes, it's not as prevalent in this space, but we look at it a little bit differently and more from a market or commercial perspective. So it's an interesting one that's definitely gained a lot of investor attention in the last couple of years.
I feel like I'm seeing it everywhere, and maybe it's because I've like put it out in the world that this is what I'm interested in, and so now I'm starting to see more and more. But it was a huge topic when we were actually where we met at the CIO
Yeah.
conference, and obviously it's a room full of women at a healthcare private equity conference, so it's naturally going to be a point of discussion. But yeah, I'm curious too. There was a lot of discussion around those that are working in private equity firms, and there's still kind of that just stigma of like, ooh, I don't really want to go there. Almost like people are like rebranding women's health to like be another name so it doesn't kind
Yeah.
of carry that connotation. But I'm wondering if that tipping point is going to be when there's policy change that is making just the economics incredibly, attractive. And it's going to be something that people can actually start to change. So it's, getting that at the government level. And then ultimately, then the dollars are going to start to follow
Yeah.
within there. And it's not just mission oriented, but, at the end of the day, this unfortunately is how people function.
Yeah.
It's gotta follow the reimbursements.
Yeah. And I think, women's health is definitely something that's a little bit in earlier innings when we look at a lot of other provider services. But I think where we've seen the most growth is really in that fertility and IVF space. I think that's something that, especially with the current administration, we've seen a ton of support for IVF services and just general guidance, not necessarily real policy changes yet, but I think that kind of bipartisan support we've seen over the years has been an interesting driver here.
I find this incredibly interesting because, there's not many other industries that are out there that are so contingent on, what is happening. You go into fintech, you go into, other, industries, and it's not something you have to keep your pulse on. Your perspective is just incredibly valuable. But as we wrap up the conversation, I have been asking everyone the same question. And it's been really interesting to see we've actually had the same answer to the last two people that have been on here. But I'm calling this our one fix. And so, with this, if you were to have one magic wand and you could fix one thing in healthcare tomorrow, no budget constraints, no regulatory constraints, no politics, what are you fixing?
Yeah, it's a great question. And I think a lot of different angles that this could be approached from. But one thing that I think has been top of mind as we've been discussing the Medicaid space a lot are some of the fraud, waste, and abuse scrutiny that we're seeing right now in the space. And I think the market is treating the scrutiny as a reason to kind of avoid certain sectors within healthcare, things like personal care or ABA that have been at the height of all of this scrutiny. But I think there's an important distinction to make between looking at, if a service is actually fraudulent versus this service maybe has a few bad actors who've been exploiting something like a reimbursement structure. So if I had a magic wand, I think what I would address is the whole fraud, waste, and abuse conversation that I think, it's an important conversation to have, but I think when we crack down on bad actors in a space like personal care or ABA, we don't want to unintentionally end up making it harder for populations like children or people with disabilities who genuinely depend on these services to get care. I think a lot of the time the crackdown response is blunt and industry wide. And while the goal is to weed out bad actors in healthcare, I think my magic wand, I'd want to ensure that patients aren't impacted with their quality or access to care.
How do we insulate them
Exactly.
from the ripple effects of it all? Well, thank you so much for joining me today. Yeah, like I said, I feel like I could talk to you forever. You are a wealth of knowledge. And so just so glad to have you. And we will
Yeah,
catch
absolutely.
you
This is a
soon.
great conversation, and I think yeah, we could have gone on for hours here within the policy changes. But thanks so much for having me, and this was great discussion.